Okay, thank you very much. Thank you very much. Good evening. I'm Dr. Amdatu Ambali Adedokun from Fountains University Medical Laboratory Science Department. So this evening, I am here to talk about the topic Know Your Discipline from Theory to Relevance. The introduction in terms of medical laboratory science as a whole, that it has to do with healthcare delivery system that involves many different personnel and specialty of caregiver of that are caregivers must have to understand or understanding the working knowledge of other professional endeavors, including the role of diagnostic evaluation. So, as medical laboratory science students or medical laboratory scientists to be, we are in collaboration with other professionals in order to carry out diagnostic evaluation for the patient satisfaction. That basically laboratory and diagnostic tests are tools by and of themselves. They are not therapeutic. So when we do our laboratory findings or diagnostic investigation, is not enough for problem solve. It has to go to the other side where the final report will have to be used for therapeutic inference. So that in conjunction with pertinent history and physical examination, that these tests can confirm a diagnosis or provide valuable information about patient status and response to therapy. So in the case where drugs or medications are given to patients, we are still responsible in monitoring of patient status and progress of therapy. That in addition to this, laboratory findings are essential for epidemiological surveillance and research purposes. Some of us in the field of science who want to venture into having information, solving disease prevention and control, and some may also dive into research purposes for academic improvement or for other reasons. That if the entire work network of a laboratory science services is to be effectively utilized and contribute to healthcare and disease prevention, every member of its workforce needs to understand the role of the laboratory and its contribution to the nation's health service, appreciate the need to involve all members in the provision of health services, follow professional ethics and conduct and code of conduct, experience job satisfaction, and have professional loyalty. In terms of prevention and control, all other workforce being just like we call it the joint health workers, every other personnel have to be involved in decision making, so as also the medical laboratory scientists are also part of decision making as well as making progress in all sectors, and it has to do with professional ethics as well as the code of conduct which every individual or personnel must follow. Now, for those of you, for the purpose of this program, as students and scientists to be, I decided to bring this basic art and science because for some students or for some persons, they feel By the time you do English language, mathematics, it's all over, maybe at 100 level, and that is all. But that's not the end. Even till after you finish your university, you will still go back and do all this together. So here, why I added the English language and mathematics, it's very important in terms of communication or finding some, for some students or for some personnel, we are having issues with English communication. What way are you supposed to express yourself, as well as the handwriting? Then, in terms of calculation, before ever you do anything in the laboratory, even the normal saline you want to prepare, you must calculate. You want to prepare media, you must calculate. You want to do this or that, you want to weigh, you have to do one calculation or the other before you even start the weighing of whatever reagents you want to produce, sodium hydroxide, you want to produce formol saline, and so on. So you need to be up and doing in both English language as well as mathematics. Then moving to the basic sciences, biology, physics, chemistry, anatomy, physiology, and biochemistry. All are interwoven. They will still come every now and then, every minute, every time of each courses a student must take, be it at 100 level, 200 level, 300, and so on. Like I also mentioned, even after graduation, you will still need them. Even at final year, questions that may be asked from students who are defending their proposal or seminar may not be the field of where they are specialized. It most times comes from physics, chemistry, anatomy, physiology, and also biochemistry, because you are expected to know this foundation before you get to that level. So, in order to make live or questions easier, some lecturers may prefer to go down to those areas you have felt is not important. So it seems it fits for every student that you should not overlook, as small as English language or biology, physics, that you need to always go back to those courses every now and then as you move forward in the field of medical laboratory science. We have medical laboratory science has different specialties, but as students of medical laboratory science, it is expected to for every student to be grounded, whether in microbiology, hematology, clinical chemistry, immunology, histopaths, and so on, even molecular biology. You need to have the basics of these different specialties as medical laboratory scientists. It will still be important. You never can tell where you find yourself after your classwork. After graduating, you may be the only one in a particular lab and you need to do microbiology. You may be the particular lab, you're a chemical pathology, you need to do hematology for a patient. And being a medical lab scientist, you do not have any option to say, I don't have knowledge in this or that. You are supposed to be up and doing, you're supposed to do these courses, you're supposed to do those laboratory investigation as soon as they arrive, except where you have large number, where your organization may have different people from different fields. They employ micro, they employ hematology, they employ histo, and so on. So you as a personnel, as a medical lab scientist, you have to be up and doing, by having grounding or recalling this information as time goes on. So here, I just want to use this figure of diagram where I have cellular response to injury to explain the interrelationship of our different courses, our different specialty. Some of you that have been in the clinic from 300 to 45 doing your clinical posting, you will observe when the doctors write, they want to do differential diagnosis. This differential diagnosis will either involve full blood count, whilst that also include fasting lipid profile, may also include fasting blood sugar. They will also say you have to do urine analysis. Then maybe MCS, all because of the complaint an individual has clinical features, the individual has complained to the doctor, and the doctor will need to do differential diagnosis in order to to carry out the final diagnosis. So in relationship, like I stated, we have scenarios where causative agents of cell injury using that previous diagram that we have, for example, hypoxia and ischemia. We also have physical agents, chemical agents and drug, microbial agents, immunologic agents, nutritional derangement agents, psychogenetic diseases, iatrogenic factors, and idiopathic diseases. If we go through all these, I'm only going to use the hypoxia and ischemia. For the hypoxia and ischemia, when we look at this schematic diagram, where I have sent the material to Amar, so you must have dropped it on your group, where we have the normal organelles. The normal organelles. When we talk about cell injury, there is always either reversible cell injury or irreversible cell injury. When the these are in cellular level, but why I decide to use this scenario, we have a case of reduced oxygen supply and ischemia where there is even deficiency of this blood supply or oxygen going to the different parts of the body. With this condition, it's going to affect the cells of that particular patient. So here we have the hematology coming in, doing their own diagnosis, looking at blood percentage, looking at the oxygen carrying capacity of that particular patient. Then we also have chemical pathologists doing their other investigation or the correlation with the hematological findings. And we also have the histopathologist, where possibly if this individual is doing a biopsy or for example, not autopsy, because we are looking at a living patient. So the physician will bring all these reports together in order to balance if there is hope for this individual or is going to lead to cell death, where we have the apoptosis and the necrosis. So that is just the example I want to use for our interrelationship. There are several interrelationships between hematology, chemical pathology, histopathology, as well as microbiology. And like I mentioned, there are cases where we have immunologic agents. So there we classify disease like the lupus, systemic lupus, erythematosis, and so on. Those are the autoimmune disease cases. So that's just the example I want to use for the interrelationship. Now, our role as medical laboratory science in the health care center, that we do examining and analyzing blood, body fluids, tissue, and cells. So also conveying results of tests to doctors and nurses and monitoring welfare through the use of laboratory testing, then performing differential cell count to find abnormal cells in the case of diagnosis illness such as anemia as well as leukemia. Then we also establishing quality assurance and reliability procedure in order to guarantee the accuracy of test results. Then blood typing and cross matching for blood donor for patient transfusion. Also testing blood for drug levels, finding abnormalities in blood clotting, and managing medical laboratory technician as well as the assistant, then standardizing drug potency, and also designing and conducting research study that investigate diseases and methods to prevent and treat them. Moving to career opportunity. As medical laboratory science or scientists to be, there are a whole lot, several. When I mean several, it all depends on the system or where you find yourself. There are whole set on so many career opportunities that anyone who is a med lab scientist can venture into. One, we have as in areas where we have hospital center, we also have healthcare agency or government, healthcare administration, education, industry, and others. Now, moving to healthcare or hospital medical center. One good example is that a med lab scientist can venture into andrology, which is also fertility testing. Andrology, one can also decide to have a blood bank, can do coagulation, even computer science, cytogenetics, endocrinology, flow cytometry, forensic science, genetics, infectious control. I'm just trying to call the ones that are unfamiliar. Then nuclear medicine. You can be a pathologist, anatomist. Then quality assurance, tax laboratory, transplant services, and so on. For areas where it's just hospital aspect. For the agencies, the healthcare agencies, we have some of them like the HMO, Hospital Management Organization here in Ministry of Health in Abere in Osun State. It's also everywhere in every state we find ourselves. As medical lab scientists, when we graduate, you can also be part of those that will make decision for the profession. So we have those who are administrators for veteran, biometrics, clinical lab, crime laboratory scientists, Department of Health for educator, then Department for Health for proficiency test consultant, employees recruitment, placement officer. You can also be involved in environmental health inspector, environmental pathology technologist. When you hear technologies, this document is actually gotten from one of the US, an article from US. So we are seeing names or acronyms that are not common in this area. One can also be a fraud investigator, health management organization, can also be a military person. Like here in Nigeria, I have seen it's here, this particular, you can be in the military and be the med lab scientist. Like when I was in Port Harcourt, I went to the military hospital. The military hospital, the scientists put on military uniform they do put on uniform. So in NASA, one who is in aeronautics too, one can work in aeronautics, patient educator, private investigator, FBI, as medical lab scientist. Like I mentioned, it depends on where any of you find yourself. If Nigerian system is still backward, it is for you, the young shall grow, or the leaders of tomorrow, to come and do one or two changes in terms of updating or improving the system, because for us to do that, somebody must be in power in order to put this to law. So in healthcare administration, we can also be clinical manager or administrator, coder, abstractor, emergency medical services coordinator, financial manager, planner, group practice administrator, hazard waste coordinator, healthcare administrator, health insurance, health policy analyst, health promotion coordinator, so many, laboratory supervisor, laboratory administrator. These are administrative parts. We don't need to struggle to say, no, it must be in the lab that I must work. So we are, you as students or as graduates, as a medical lab scientist, you need to do other courses. You can also say you want to venture into education, where you have to work as where we are now in Fountain, we call it College of Medical, Basic Medical Health Sciences. But ideally, they put it as Allied Health Sciences. So if you want to work with the Allied Health Science, you can be the Allied Health Dean. You can be a dean, you can be education coordinator, can be educator of students, faculty member, and higher education educator, instructor in veterinary and medicine allied, because some of our scientists are also in vet, they are in vaccine, different places. It all depends on your other certification that will make you have opportunity to get to these places. One can also be in industry, where you produce advisor in development of or inventor of laboratory tests. You can decide to say you want to use different, this company is using a particular method for their reagent. I want to now discover another material that we can use in order to invent a particular test for pregnancy test. It can be for malaria, all maybe the RODTs. One can also go into the business aspect. Then biomedical specialist for occupational health, cell culture consultant, computer consultant, director of marketing, editor. Some, that's, I still mention English language. You can see you can also get to being an editor because of medical publications. You write, become a writer, and you also publish. Then food technologies, quality assurance manager, then healthcare reimbursement coordinator, health promotion and education, installation specialist, because some of us will need to have the skill in order to do one installation of our equipment. Because if you know how much the biomedical engineer are charging for equipment, let's say if you buy an equipment for 10 million, you're going to give them like 20% of that 10 million for installation. That is almost how they charge, do their services as or medical engineer. So if you are a med lab scientist, you can also include a skill of biomedical engineering, so specialist, or where there is troubleshooting and you have skills for those particular equipment, one can still be called. Like there's one of the doctors, if you know, one of the doctors amongst us, one of them is at Ila now. He has a skill of biotechnology where he can skills he had before becoming, while he was a student, he was going for one electrical skill, especially working on equipment. So those are the extra work that he did, extra skill that he also added to get put food on his Okay. Sorry for the network issue. So, being in industry, one can do so many things. Like we also have medical claims. One can also be medical claims reviewer, medical consultant, medical field analyst, then owner, director of employee placement service, product specialist. For a whole lot, one can also be salesperson, technical representative of their company, being a medical lab scientist. Then, in other aspects, one can also venture into research for basic and applied research, where a scientist can be an assistant associate scientist, director of research, medic for humanitarian work. You can also have medical missionary work, Peace Corps, Project Hope, and others. These are where we talk about medical outreaches just to serve humanitarian, and organization or non-organization can also be involved, and scientists too can also partner or collaborate with non-governmental organization in order to give humanity their best or contribute to the society. So, as medical lab scientists, that we have certain common characteristics. One is that we are problem solvers. Then, like, they also like challenges and responsibility. I want to believe that you, as med lab scientist, to be, you always like challenges. Then, that they are accurate, reliable, work well under pressure, and are able to finish a task once started. This is always normal for us. When we start our work, we can't leave it, we can't do a leftover. We have to finish because we want to solve someone's problem. We want to give patient satisfaction. Then they communicate well, both in writing and in speaking. If you, as a med lab scientist, we have trained, or med lab scientists to be, we have always trained you to do writing as well as speaking, while we give some of you, most of you, assignments, come and do presentation. These are the skills we try to build up for you all as students and for scientists to be, that they set high standard for themselves and expect quality in the work they do. If you have passion for being a med lab scientist, you will always be setting standards, using professional ethics, the codes of conduct, making sure that all aspects, when we talk about the analytical stage, and post-analytical stages or phases of investigation, are properly done based on professional conduct. That, but above all, they are deeply committed to their profession and are truly fascinated by all that science has to offer. Then another saying is that for someone who chooses a career in the medical laboratory, the exploration never ends. It actually never ends. You may even start a particular diagnosis now, hoping that, okay, maybe in the next 30 minutes, I will be through. But before you know it, you're seeing something else. Another thing is coming up, whether it is in histopath, whether it's in, so you just need to continue to explore in order to get the final answer to your investigation. So, in conclusion, The medical laboratory services is a key sector in the healthcare system, and its contribution cannot be overemphasized in patient satisfaction, disease evaluation and monitoring, deciding effective control measures, and priority and allocating resources. So I have this saying that to achieve success in life, you need to be sweet as honey, be regular as flock, be fresh as rose, be soft as tissue, and be strong as a rock. I want to thank you all for listening to me tonight, and also thank you for giving me the opportunity to talk to you. Thank you very much.
Thank you very much, Ma, for the impactful session. We really appreciate you. That is a impactful speech by one of our mother, our mentor, and our guardian, Dr. Hamdatu Hadidoku Hambadi. So a lecturer from Fountain University, Department of
Thank you.
Medical Laboratory
My own
Science.
network is bad.
So I hope we all enjoying the speech, as she has really discussed a lot concerning our profession. She really talked about how we can stand out within our mate, and we ask Allah subhanahu wa ta'ala to increase her in knowledge, to preserve our life upon goodness, and to make us, we listeners, we hosts of the program and the listeners, a great scientist in the future. I mean, with this, I think we come to the end of this of the phase two of our online webinar organized for all MLS students in the department. And I say to you all, stay active, stay motivated. Melsa Ginger, the Melsa Swagger, the Melsa Active. Thank you all, and